Hello, you're listening to the MiCare Championcast. I'm your host, Ciaramitaro of the Michigan Health and Hospital Association. Each month, we invite industry experts and thought leaders to discuss relevant healthcare issues. Join us as we explore key topics that affect Michigan hospitals, health systems, and the health of our communities. Hi, thanks for listening to the MiCare Championcast. On today's episode, we're going to learn about the 340B drug pricing program, specifically what that is and the benefit it offers to our small and rural hospitals and health systems. We're lucky to have two very special guests from Mackinac Straits Health System, which serves the Mackinac region and includes a 15-bed critical access hospital, a rural health clinic, emergency room, walk-in clinic, outpatient surgery center, infusion center, and long-term care facility. They also offer radiology services, cardiac rehab, physical therapy, and a retail pharmacy, which we'll talk about more in today's episode. The first guest I'll introduce is Karen Cheeseman, who has been Chief Executive Officer at Mackinac Straits since 2017. Karen has been with the health system for 17 years, previously serving as Chief Operating Officer and prior to that, Chief Human Resource Officer. Karen is a member of the American College of Healthcare Executives and has served on both our Small and Rural Health Council and Legislative Policy Panel at the MHA. Our second guest is Leah Heffernan, who has been with Mackinac Straits as a Retail Pharmacy Director for 5 years. Leah has been key in making the retail pharmacy a success and is in the trenches daily working to ensure all operations run smoothly. Ladies, welcome and thank you for being here.
Thank you, Lucy.
Thanks, Lucy. Thanks for having us this morning.
Of course. So before we dive into the outstanding work being done at Mackinac Straits Health System, can you provide our listeners who may not be familiar a high-level understanding of 340B and the drug pricing program and how it helps your hospital and the community?
So the 340B program dates back to 1992, and it is a federal drug pricing program that requires drug companies to provide discounts on most outpatient drugs to qualifying safety net hospitals, clinics, and health centers. The Mackinac Straits Health System qualifies for this program because we have a special designation, which we refer to as a critical access hospital designation. We take the savings and we expand upon services that we feel are important to the community. And this is important because it doesn't occur at any additional cost to the taxpayers and the community as a whole.
I just want to clarify for our listeners who may not be aware that a safety net hospital is a medical center that has a legal obligation or mission to provide health care for individuals regardless of their insurance status or ability to pay. So I just want to clarify for those who may not know what safety net means. And I know you certainly both have unique perspectives on how valuable the program is, which we'll get into shortly. But first, I'd just be remiss not to acknowledge how the COVID-19 pandemic has impacted the healthcare system in many regards, including this one. Can you explain what role 340B plays in assisting hospitals to emerge from the pandemic and operate financially?
Certainly. So early into the pandemic, the non-essential patient visits, elective surgeries, etc., were not permitted for a period of time. And this put a significant financial constraint on hospitals all across the U.S. And it had a significant negative financial impact. Without the patient visits, we couldn't generate the volumes that feed our 340B program. Mm-hmm. So we experienced a pretty significant decline. Now, since that time, we've steadily rebuilt our volumes as restrictions were lifted, and our patients and our community felt comfortable coming back into the hospital to receive their healthcare services. Right. As we experienced the different surges all throughout the pandemic, we experienced significant increases in certain areas of the health system. Such as our inpatient unit, our fast care, urgent care clinics, and our emergency room services, all at various degrees at different times throughout the pandemic. Mm-hmm. The pharmacy played a key role during that time in providing the necessary medications, not only to the COVID patients, but ensuring that other patients that had other needs, that their needs were sufficiently met. So we adapted and provided curbside service so that we could keep our employees and patients and community safe during that time.
Absolutely. And to your point, I'll just mention, we know 81% of critical access hospitals used 340B savings to increase access, like you're mentioning, to care for low-income and rural patients, and 74% reported needing them to keep their hospital doors open. And that information comes from a 2021 survey by 340B Health, which I thought was pretty staggering and really puts into perspective how vital the program is.
Absolutely. It's something we couldn't be without.
Well, statistics are one thing, but stories are certainly another. And I know Mackinac Straits is doing great work and using their savings from the 340B program to reinvest in community health. Can you share with our listeners how you're doing that?
Sure. So broadly speaking, we take the savings and we expand upon services that we feel are important to the community. So, as discussed earlier, we are located in a rural and underserved areas. So we have the ability then throughout this program to offer free and low-cost drugs to our patients. It helps us cover the expenses with uncompensated care, and also allows us to offer a variety of programs and services to improve the outcomes of the health of our community and address various social determinants of health. So more specifically, every 3 years, the health system completes a community needs health assessment. And the feedback from our community was very clear that they needed improved access to pharmacy. So when you're in a rural community, you don't have the large box stores on each corner, the CVS, the Walgreens, etc. So if our patients had needs outside of normal business hours prior to our pharmacy being developed, they would have to travel significant distances to get their prescription medications.
Right.
So in our case, that would include 30 to 60 miles of travel one way for patients to access the pharmacies.
Wow.
So we took that feedback and we listened to our community and our patients, and that led us down a path to open our own retail pharmacy here within the hospital.
So our retail pharmacy that we opened is Straits Area Pharmacy. It is a retail pharmacy that is open 365 days a year. We do have weekend and holiday hours for customers. We offer delivery services within St. Agnes city limits, Mackinac City, and also to Mackinac Island. These services were previously unavailable before the retail pharmacy opened. Our emergency department at Mackinac Straits also offers after-hour medication to go. This helps patients get started on their prescription when our retail pharmacy is closed or at others in town. So they get their first dose of medication and they're instructed they can take their prescription to a pharmacy, tomorrow to continue their therapy, but this way they're started right away with their treatment needs.
So what has been the feedback from patients, specifically those that have received medications through 340B?
So most patients, don't know that they're receiving these meds that way, but on the weekends and holidays when patients unexpectedly visit our fast care or our emergency department, they are very thankful that we are open. They don't have to drive to another town for their prescription, especially when they get a med to go out of the emergency room, that they're very thankful they could, go home and sleep and then come to the pharmacy the next day, not drive, like Karen said, 30 to 60 miles to go find that prescription immediately. Mm-hmm. And most recently, I'd say the feedback I've had is I had a customer on Mackinac Island, which shows that this doesn't only help our local town, but it's somebody from out of state who's visiting our area and can benefit even from this. He became ill while on Mackinac Island. He called us to inquire about how we deliver to the island if he needs the medication or if he has to come to the mainland to get it. We explained our delivery service to him, and he was beyond thrilled with us. He just kept expressing how happy he was that he didn't have to, interrupt his day, buy a boat ticket, a round trip one, and this would cost him less, and we were providing him what he needed.
Absolutely. I think examples like that really speak to how the program is impacting and supporting small and rural communities and people who aren't even from Michigan. So that's incredible. And Karen, as a hospital administrator who has served rural communities for 17 years, what would you say has been the most rewarding part about this program?
I think the most rewarding part, Lucy, is for me to look out and know that we are serving our community in the best way possible. We're removing barriers for patients who may not, otherwise have access to the medications that they need. For example, we are in our community. We don't have public transportation. We don't have a taxi service, a bus service, etc. So when we look at our patients with transportation barriers and we offer the delivery services that Leah spoke about earlier, that's key in making sure that those patients get what they need in a timely manner. So looking out and knowing that we are providing a quality service, it's very timely, it's provided with a very high level of care and customer satisfaction, is very rewarding at many levels. One of the stories that comes to mind during our first year of operation, I was making rounds throughout the hospital that afternoon, and I was approached by a community member who came in, and he was a new grandfather, and he was watching his new grandchild, less than a year old, and the child fell ill under his watch. He was very nervous, very unsettled, so he brought his grandchild in to see the pediatrician. It was getting late in the day. We were approaching the end of business hours, and the provider connected with Leah's team in the retail pharmacy and said, "We'll make sure you get the prescription filled before you go. Don't worry about the time. Don't worry about the business hours, etc. We will get you what you need." And I happened to see that patient on the tail end of his services, and he was beyond thankful that we were able to do this for him, that the team stayed, after hours to meet his needs, and he didn't have to take his sick grandchild, across the bridge and travel 30 to 60 miles to another pharmacy. So,
right.
And I look at stories like that, and that's just one of many. It goes to show we're doing the right thing and we're investing appropriately in the community.
Absolutely. And Leah, I'll kick the same question to you. What would you say has been the most rewarding part of the program from your perspective?
Just like Karen said, how thankful people are. It's nice to hear people say thank you when you do go above and beyond, but we're using the money to help people, whether they know what's happening on the back end or not. But you're nice. It's very nice, especially when they're ill or inconvenienced, something unexpected on their end. But they are just so pleased that they can get home, back to the comfort of their home where they need to go.
Right. Well, the last question I have before I let each of you go is, how can our listeners and your community continue to support these efforts at Mackinac Straits and in their own communities? In
terms of overall support, we have a very loyal patient following. We have a lot of community support and support throughout the Straits area. So continuing that support, with our patients and our community continuing to provide us feedback as to how we can best service them is key in our success. Leah mentioned earlier, we have our own community and designated service area, but we're also located in a highly driven tourist area that sees over 1 million visitors in a season throughout the Straits area. So knowing that we can take care of not only our own community but our visitors, which is so important to our local economy here, is important for the program and the continuation of the program. And lastly, we ask that our professionals working out there at the legislative level continue to support the program and protect 340B as it exists today.
Yeah, well, I know that the MHA has been working hard to protect 340B for Michigan hospitals, particularly rural hospitals like Mackinac Straits that clearly benefit from it. So I think the stories you shared today really demonstrate the impact of the program, and I thank you both for being here.
Thank you, Lizzie.
Thanks for the opportunity.
With that, I'd like to thank our listeners for tuning in and encourage you to visit the link in the episode's description, which leads to our MHA Legislative Action Center and makes it easy to contact your state lawmakers to protect 340B in just a few quick steps. If you're interested in learning more about Mackinac Straits Health System, head to MackinacStraitsHealth.org. Thanks, and have a great rest of your day. Thanks for listening to the MiCare Champion Cast. To learn more or get involved, visit MiCareMatters.org. That's MiCareMatters.org.